Today we are going to examine the hand. First, introduce yourself to the patient and take permission for the examination of hand. Make sure that patient is in the sitting up posture on the bed with hands on the pillow and palms down. Hands rest and forearm up to elbow should be exposed. Perform a usual inspection of whole patient from head to toes and particularly look for cushingoid, scleroderma and acromegalic fasces and any other obvious joint deformity. Stand in front of the patient and examine the hand symmetrically. Compare the both sides. Follow, look, feel, move and function protocol for rheumatological examination of the hand. Start with the rest, metacarpophalangeal joint, proximal interphalangeal joint and distal interphalangeal joint and nails. Compare right with the left. Symmetrical involvement of the wrist, metacarpophalangeal joint, proximal interphalangeal joint swelling suggests rheumatoid arthritis. First, you have to inspect the skin for erythema, atrophy, rashes, and scar marks. Scars suggest previous surgery or tendon repair. And inspect for wasting of intrinsic muscle of the hands with dorsal guttering. In case of dorsal guttering, there will be hollow ridge between the metacarpal bones. Inspect the joint for any swelling and deformities. Look for characteristic deformity of rheumatoid arthritis, such as subluxation of the wrist and swan neck deformity, boutonniere deformity and Z deformity of the thumb. Swan neck deformity consists of hyperextension of proximal interphalangeal joint and fixed flexion at the distal interphalangeal joint. Boutonniere deformity is the fixed flexion of the proximal interphalangeal joint and hyperextension at the distal interphalangeal joint. Z deformity of the thumb consists of hyperextension of the interphalangeal joint and fixed flexion and subluxation at the metacarpophalangeal joint. And look at the distal interphalangeal joint for any swelling and bony overgrowth. A burden node in case of osteoarthritis. And look at the nail for evidence of vasculitis such as nail pole infarct, telangiectasis, and evidence for psoriasis such as ridging, pitting, hyperkeratosis, onycholysis, and discoloration of the nail. Now ask the patient to turn the hand over. Now inspect the palm for wasting of thenar and hypothenar eminence. Wasting of hypothenar eminence suggests ulnar nerve injury, and wasting of thenar eminence suggests median nerve injury. And inspect for Palmar erythema and Dupuytren contracture. Now ask the patient to make a tight paste to assess the end power and function. Now ask the patient to extend his finger. Now ask the patient for flexion and extension at the wrist and radial deviation and ulnar deviation at the wrist. This is radial deviation. This is ulnar deviation. This is wrist flexion. This is wrist extension. Now we will proceed to feel protocol. First, feel for temperature, then tenderness, and then swelling, and it is characteristic. Feel for temperature with the back of your finger. Start with the wrist. Feel for temperature. Now feel for tenderness. Ask for pain and tenderness and palpate joint symmetrically. जोड़ों में हाथ में दर्द तो नहीं हो रहा है. Feel for tenderness over the wrist joint. Place the thumb over the dorsum of the wrist and support the wrist with the index finger beneath. Palpate the distal end of the ulnar and radial bone. Then palpate this groove for carpal bone, tenderness, and palpate the ulnar and the radial styloid bone for tenderness and swelling, and it is characteristic. Then palpate the anatomic synapse box. Anatomic synapse box is become more visible when the patient abduct his thumb is formed by abductor and extensor muscle of the thumb. This is anatomic synapse box. Tenderness over this area may suggest occult scaphoid fracture, and also tenderness and swelling over these tendon, abductor and extensor tendon of the thumb may suggest tenosynovitis, that is decurving tenosynovitis. And compare it with the left. Palpate the anatomic synapse box and palpate the abductor and extensor tendon of the thumb and observe for any swelling over this area, and it is characteristic. Now compress the metacarpal bone between thumb and index finger of your hand compress it to assess for any tenderness. Now palpate the metacarpophalangeal joint. Palpate it with both thumbs for any swelling, deformities. Compare it with the opposite side. Now palpate the proximal interphalangeal joint. Proximal interphalangeal joint. Hold the proximal interphalangeal joint with thumb and index finger of the left hand and palpate its front and back with thumb and index finger of the right hand, like this manner. Remember that joints are three-dimensional structure. It need to be inspected and palpated from the front, back and the sides. Feel for any swelling, any deformity. Compare it with the opposite side. Proximal interphalangeal joint. Bouchard node can occur in case of osteoarthritis over the proximal interphalangeal joint. Now palpate the distal interphalangeal joint. The same technique is applied. Feel for any bony overgrowth, a burden node in case of osteoarthritis over the dorsolateral aspect of the distal interphalangeal joint. Now look at the nail for evidence of vasculitis such as nail port and part telangiectasis, and for evidence of psoriasis, pitting, raging, onycholysis, hyperkeratosis, and discoloration of the nail. Now ask the patient to turn the hand over and palpate the hypothenar eminence. Wasting of hypothenar eminence suggests ulnar nerve injury, and palpate the thenar eminence. Wasting of thenar eminence suggests median nerve injury. And palpate the flexor Palmar tendon and palpate for thickening of the fascia in case of Dupuytren contracture. Compare it with the opposite side. This is hypothenar eminence. This is thenar eminence. And palpate the Palmar fascia for evidence of thickening in case of Dupuytren contracture, and palpate the flexor tendon for evidence of inflammation, for evidence of nodule and crepitus. Now we will will proceed per move protocol. Starting with the wrist. This is a wrist flexion. This is wrist extension. This is wrist radial deviation, and this is ulnar deviation. Compare it with the opposite side, wrist flexion and wrist extension. And this is radial deviation, this is ulnar deviation. Flexion at the metacarpophalangeal joint, and this is flexion at the metacarpophalangeal joint and extension at the metacarpophalangeal joint. To assess range of a movement and degree of limitation, now ask the patient to flex his distal interphalangeal joint by keeping a stabilized proximal interphalangeal joint. Good. Distal interphalangeal joint flexion by the flexor digitorum profundus. Now compare it with the opposite side. Stabilize the proximal interphalangeal joint. This flexion of distal interphalangeal joint by flexor digitorum profundus. Now assess the flexor digitorum superficialis. Please flex it. Now compare it with the opposite side. This is par flexor digitorum superficialis. Now assess the function of the end. Ask the patient to fasten or unfasten his button. Please undo your top button and close it again. This is key. Please pick up this key. जिस तरह आप लॉक खोलते हैं दूसरे हाथ से. Now assess and grip. ये जोर से बंद करें. जोर से. This is hand grip. Ask the patient to grasp your index and middle finger. Now assess for thumb opposition. इस अंगुली को इसके साथ मिला लें. Against the resistance. इस अंगुली को इस. Now assess for thumb abduction. इसको ऊपर कर लें. Ask the patient to straight up his thumb against resistance. इसको ऊपर कर लें. ऊपर कर लें. इसको ऊपर कर. Finger extension. Now assess for dorsal interosseous muscle by asking the patient to spread his finger against the resistance. Now assess the finger adduction with the help of a card. or with a piece of a paper. दोनों हाथों से remember that there are three nerves and there are three tests for each nerve. For radial nerve, we will check the wrist extension, radial nerve, wrist extension and finger extension and thumb extension. Three tests for radial nerve, wrist extension, finger extension at the metacarpophalangeal joint and thumb extension. In case of radial nerve injury, there will be wrist drop, finger drop and thumb drop. And there are three tests for median nerve. Median nerve, thumb abduction. This is for thumb abduction and thumb apposition and wasting of thinner eminence. Three tests for median nerve. Three nerve, three tests. And for ulnar nerve, there are three tests for ulnar nerve. One is finger abduction against the resistance and especially the index finger, and there will be the wasting of the first interosseous muscle and finger adduction. And the third is the thumb adduction. There are three tests for ulnar nerve. Three tests for radial nerve, three tests for median nerve and three tests for ulnar nerve. Now, test for carpal tunnel syndrome. Ask the patient to press the back of his both ends tightly for 30 seconds. In case of median nerve compression, there will be the paresthesia, pin and needle sensation in the affected end. In the distribution of median nerve, do you feel any pin and needle sensation?
No.
No. This test is called Phalen test or wrist flexion test. Now test for Tinel sign or Tinel test. At the base of the palm, tap with the finger over the flexor retinaculum. Do you feel any pin and needle sensation? No. Remember, this median nerve is supplied the first three digits and the radial of the ring finger. This area is supplied by the median nerve. In case of carpal tunnel syndrome, there will be the pin and needle sensation in this area. Now we will proceed for pinprick sensation. Demonstrate to your patient. Do you feel this one?
Yes.
Now close your eyes and pinprick sensation over the index finger per median nerve. Do you feel this?
Yes.
And over the little finger per ulnar nerve. Over the index finger per median nerve, over the little finger per ulnar nerve. Do you feel this?
Yes.
It is equal on both sides? Equal? Yes. Is it equal?
Yes.
And hover the dorsal web between thumb and index finger, this area, this is dorsal web, per radial nerve. Remember that this area over the dorsal web between thumb and index finger is supplied by the radial nerve, while this area, thenar, eminence, and these first 3 digits and the radial arc of the ring finger is innervated by median nerve, while hypothenar eminence and medial arc of the ring finger and little finger is innervated by ulnar nerve. And examination will not be completed without examination of elbow. Now ask the patient to touch his shoulder and inspect the both elbow for evidence of rheumatoid nodule, psoriatic plaques, rashes and swelling. Now feel it for temperature with the back of your finger. Now palpate for tenderness over the medial epicondyle and lateral epicondyle, and palpate over the olecranon for evidence of rheumatoid nodules, and palpate for any swelling and deformities. Palpate the lateral epicondyle for tenderness, medial epicondyle for tenderness, and over the olecranon for rheumatoid nodules and for any joint swelling and deformity.